So dive into that conversation. Elsewhere, Germany is just one of the many countries that is currently stocking up on the supposed COVID-19 vaccines. Is there hope for the rest of the world? Well, we'll chit-chat more about that in a moment. Thank you for joining us on this broadcast. So our question of the day to you is, are you willing to get the COVID-19 vaccine when it is ready? And if not, why? Let us know. That hashtag is the new normal on our social media handles. And remember, you can also reach us using that number at the bottom of your screen. But before we get to understand vaccination during a pandemic, let's look at the effects of COVID-19 around the world. And those numbers this morning stand at 63,070,279 people confirmed to have contracted COVID-19 around the globe. 43,544,373 have recovered from COVID-19. And out of that number, unfortunately, 1,465,095 people have succumbed to COVID-19. And now in the country, as per yesterday's briefing, that number stood at 83,316 Kenyans who have contracted COVID-19. Out of that number, 54,975 have totally recovered. And unfortunately, we have lost 1,452 Kenyans to COVID-19. Remember, this is something we reiterate every morning here on Your World. Do take care of yourself, wear your mask, practice social distancing, and of course wash your hands regularly. And if you do not have that, please use your alcohol-based sanitizer to ensure we avert the spread of COVID-19. And back to that conversation of the day. Remember, our question of the day to you, even as you take part of the same, are you willing to get the COVID-19 vaccine? If not, why? Would like to understand what your concerns are, if at all. Remember, hashtag new normal on our social media platforms. And of course, you can reach us on SMS using that number at the bottom of your screen. Well, I'll take a look at some stories making headlines across the world. And forces loyal to Tigray's ruling party have been battling Ethiopian soldiers in the northern region for nearly 3 weeks, sparking a refugee exodus, civilian atrocities, and fears of broader instability in the Horn of Africa. Prime Minister Abiy Ahmed, last year's Nobel Peace Prize winner, gave the Tigray People's Liberation Front, that is PLF, 72 hours to surrender, an ultimatum rejected by the leader of the dissident region, who has said his people are ready to die for their homeland. As the deadline looms, the UN Security Council held its first meeting on the crisis despite disagreement between European and African members over whether the closed-door discussion should take place. Amnesty International urged Ethiopia against using artillery and aerial bombings in Mekelle, appealing for both sides to consider the city's 500,000 inhabitants and the many more seeking refuge there from fighting elsewhere. And still on the same, Ethiopians from the Tigray region living in South Africa protest outside the Department of International Relations and Cooperation in Pretoria to demand the immediate end of the ongoing conflict, pitting Ethiopia's federal forces against the Tigray People's Liberation Front.
There is no internet, there is no electricity, everything is blocked. My family is living there, and I don't know nothing about what's happening, whether they are dying or they are still alive. We just hear that they are bombing there. So you can imagine how stressed and worried we are. We have no idea what's happening. We just hear from Ethiopian government because he's always informing, we are bombing this, we are bombing that, we are controlling this, we are controlling that. So we are in such pain right now.
Stop! Ethnic cleansing. The new leader of Ethiopia, and Abiy Ahmed, is the killer. You don't deserve a Nobel for that guy. Never. He's bombing our people. Stop! Tigray! Genocide!
Now, in the town of Maikadra, in the Tigray region of northern Ethiopia, ethnic Amhara militiamen find dead bodies as they investigate a massacre of hundreds of civilians. In Gondar University Hospital in the neighboring Amhara region, survivors of the bloodshed recover and recall what they lived through. Linger over who is to blame for the massacre on November 9th, with participants in the 3-week-old conflict seeking to absolve themselves of an atrocity that bears the hallmarks of a war crime. Amnesty International, which revealed the killings, and the government-affiliated Ethiopian Human Rights Commission point the finger at groups loyal to the Tigray People's Liberation Front, but Tigrayan refugees who fled Maikadra for Sudan instead say pro-government forces were responsible for the killing during a brutal assault on the town of 40,000 people. Now to something that gives us focus on what we'll be talking about this morning. In October this year, Baringo County was hit by another bout of malaria that left many locals in Tiati desperately seeking treatment. The problem, however, is that although it's treatable, Tiati residents barely have access to medicine as hospitals struggle with shortage of drugs. Charity Mwangi with more.
The community in Baringo is still fighting the good old enemy, malaria. The talk of the fight against COVID-19 to them is a foreign battle involving the city folk. Theirs is a story of a neglected community facing a disease that ought to be manageable but continues to cause havoc in their lives.
Ukosefu wa neti. Sana sana huku hakuna net, hiyo ndio imechangia sana sana hii malaria.
They line the corridors of health facilities to seek treatment after traditional remedies failed.
Hapa unapata wengine wanazimia kwa sababu joto iko juu sana ya malaria. So wakifika hapa unapata wagonjwa ambao wako chini sana. Imetufanya hata tunakaa na uoga mwingi.
The medics say that they fear they are fighting a losing battle on account of poor facilitation from government. The government-owned health facilities are not fully stocked with medicine to combat the disease.
Madawa ya malaria unakata saa zingine, wakati mwingine hakuna kabisa hizo antimalaria za kupatia wagonjwa. So inapata tunaenda tunaomba kwa facilities kama Chemolingot ama Saidia Tangul Bay. Ndio tunaweza pata dawa ya malaria, ama hata wakati mwingine tunanunua.
Kindly serikali tu wangetukamilishia hii building na waweke stawa, madaktari ndio wenyeji wapate kufurahia kuwa Wakenya kama wengine.
The medics say most people in the community have weak immune systems that leave them vulnerable to malaria since they haven't fully embraced immunization.
Shapona anaenda akiendanga tena hivyo. Akirudi atakuwa mgonjwa tu wakati anarudi, si anakuja tena kliniki.
Last year, Baringo was hit by a malaria outbreak that left nearly 10 people dead and hundreds others hospitalized. Scientists say Baringo will continue to suffer bouts of malaria because climate change is pushing mosquitoes to non-traditional areas. Charity Mwangi, NTV.
Something that definitely puts emphasis on the importance of keeping those immunization drives ongoing. Now, to something else that puts focus on the same. Children may not be the face of a pandemic, but they risk being among some of its biggest victims as their lives are being changed in profound ways. Now, this art installation in northwest England shows a child's face made out of sand. The work, supported by UNICEF and titled 6,000 children, aims to raise awareness about the situation of many children across the world who are at risk of dying from indirect causes of the COVID-19 pandemic. Access to essential services like routine immunization has already been compromised for hundreds of millions of children and threatens a significant increase in child mortality. Now, many others living under restricted movement and social-economic decline are in greater jeopardy of violence and neglect. Well, let's get into it. What does vaccination in the pandemic era look like? Well, Dr. James Gadhuki is with me in studio. He is a family physician, one of the panelists this morning to help us understand this further. In the other studio, we have Judy Nabakwe, who is an immunizing nurse at Gertrude's Children's Hospital, and of course, Sami Ndongo, who is Sanofi Pasteur East Africa head. Thank you all for joining us on this conversation. Before we get into the nitty-gritties of vaccines and immunization, let's first define what a vaccine is and what immunization is, if at all there's a difference, Dr.
A vaccine is the drug. Immunization is the act. So if I give you a vaccine, I have even immunized you, but the two terms are probably interchangeable in most people's minds. So they essentially are referring to the same thing. Yes.
Now, we've seen that report by UNICEF that so many children are at risk during this pandemic. Talk about the importance of keeping on doing these immunization drives.
One of the things to remember about this pandemic is that there is global shortages of everything, because we have vaccine manufacturers based in one country. Their markets or the people who are supposed to be getting those vaccines are in a different country. So when the logistics chain comes under stress from the COVID pandemic, it means even getting these vaccines on time becomes problematic. Now, a lot of the vaccine manufacturers are also running to try and get the production of the COVID vaccine available to the world. So it means, I mean, it's the same people. So it's a huge challenge. And then locally, no one wants to go to hospital. It's been for anyone with non-COVID needs for hospital visits, it becomes tricky, because do you want to go to hospital and pick up COVID? Well, that's the impression that people have,
yes.
Right? And then there's also just that, as much as, let's say, for example, the vaccines that the government provides are free, but they still, if people are not making money, because, I mean, there's a huge economic crunch right now. If people are not making enough money, let's say to even take that matatu to come and get the vaccine. So you have all manner of challenges to this. Plus, there's also the problem of people have traveled. people have lost their jobs, so they've gone up country. So where it is that they used to get their routine vaccines is all of a sudden different. Most vaccination centers in the country will have like a market that they're already aware of. If you did 6 weeks vaccines last month, you expect about the same number to turn up this month. So how many vaccines do you have? So it's a nightmare.
Okay, and you've given us a preview of the disruption that has happened during COVID-19 when it comes to vaccinations. And as Kenya joined the rest of the world in marking the World Polio Day back in October, health experts raised the red flag, citing risks of renewed infections. Now, the experts said that Kenya is facing a renewed risk of a polio outbreak or polio virus type 2, especially in northern Kenya, Nairobi and Mombasa, following an ongoing outbreak among some of our neighboring countries. Now, 11 counties have been flagged as having the greatest risk of polio outbreaks, including Lamu, Tana River, Garissa, Wajir, and Mandera. Now, the renewed threat of the virus stems from disruption of immunization programs due to the ongoing COVID-19 pandemic.
We need to do a lot in terms of routine immunization. So we are encouraging all mothers, our fathers, our caregivers, and well-wishers to ensure that all our children that are eligible for immunization are brought to our facilities.
While we understand that Kenya has been declared wild polio-free, the understanding and the guidance is that you have to sustain immunization for 3 years and beyond, just to make sure that you sustain the prevention of polio transmission.
Now, we are clearly talking about life-saving immunization, especially amongst children. Now, Judy, how has the pandemic interrupted the uptake of the same? Daktari has mentioned about some of the factors. From where you see it, what else have you seen disrupted?
Thank you, Gladys. We've been having challenge during this pandemic, whereby everybody is scared of coming to the health facility, and we have many missed opportunities where many children have not been coming for vaccination in the name of when they come to the hospital, they might contract the COVID-19. So most of the time we've realized most of our patients, they're not turning up for vaccinations.
Okay, and how about the ones you used to do door-to-door? Are those still happening, or those had to come to an abrupt halt also because of the concerns of COVID-19?
For the concerns of COVID, it also affected them. In a way, they used to feel uncomfortable. For us, walking from one home to the other, they might think that we are transmitting the infection as well.
Okay, and for the mothers, a very critical population, especially the expectant mothers, how's the uptake of vaccines?
For the moms, most of them, during this era, all of us were a bit reluctant, whereby every citizen knew that in the hospital is where we have the COVID. So even the uptake for the mothers was a bit low because of the COVID. None of them was willing to come to the health facility to be assisted from there.
Okay, you speak in past tense. Do you mean that when we were all understanding what COVID was, then there was a sort of a slump in the worry about COVID-19? Now there's a resurgence of the same. Have you seen any difference in these seasons?
Yes, there is an improvement, if I might say. We've won some confidence after the government trying all the efforts to educate our clients that we really need to go to the hospital when you get this vaccination, and if you prevent some simple infections, they'll reduce the chances for you to get infections. So at the moment, there is a chance. I can say we've improved, but we are not yet there.
Now let's talk to the pasteur amongst us, and this is Sammy. How has the ecosystem changed of manufacturing and, of course, distribution of vaccines in the pandemic?
Thank you, Gladys. So as Dr. Gadhuki mentioned, so the entire ecosystem is under increased stress. There are challenges like no other. As you would expect, obviously everyone is very focused on what progress is being made on a COVID-19 vaccine. But besides that, for manufacturers, they still have to sustain delivery of the other life-saving vaccines. It's a fact that even despite COVID-19 today, the other diseases have not taken leave. As you've just illustrated about malaria, there is always a risk of polio lurking behind, just around the corner. So for vaccine manufacturers, one, it's a race against time for a COVID-19 vaccine, but then even a lot more as well, it's important to keep delivery of all the other 26 life-saving vaccines that are required not just by children, the middle-aged, but also the elderly as well. Oh. So everyone is working around the clock to ensure that existing vaccines are still delivered to everyone who should get these life-saving vaccines, but that also progress is being made on developing a COVID-19 vaccine.
Now, Sami, a quick one, and this is a question actually coming from one of our viewers today. Are we saying that we are, as a country, do not have the capacity to manufacture any of the 26 life-saving vaccines?
I think you can look at it differently. Obviously, vaccines are a fairly complex affair, and we cannot say that the country does not participate. There are very many different phases of developing a vaccine. Apart from just having the antigen, there is also the clinical trials that are equally as important in the final delivery of a vaccine, where you confirm whether the vaccine works, in what population it works. Is this able to be generalized around the world as having been effective? And I think I can say this without the fear of contradiction, that Kenya and KEMRI and many other scientists have actually worked in the processes of developing vaccines. Do we do bulk production of vaccines in Kenya today? Probably not, but that does not mean that cannot happen in the future.
Okay, and we talk about 26 life-saving vaccines, a lot of those that are given to children. Judy, which are these critical vaccines for these population?
The critical vaccines is what we give as per the schedule by the government, of which we believe every child, wherever the baby is, should receive the vaccines. And we start all the way from at birth till the age of 10 years for girls. And maybe if I can just go through, we have the at birth, we normally give the BCG, which we normally inject on the left arm. Most moms, that's what they know. And we also give polio vaccine, which is normally like 2 drops per visit, of which we repeat, will come at 6 weeks. These are 2 injectables that we give just to protect against the pneumonia. And we have another one for the DPT. And we also give the rotavirus vaccine, which is given orally with the same polio. We repeat the same at 10 weeks. However, at 14 weeks, we have to change a little bit because we have to introduce now the injectable polio, as Dr. has mentioned earlier. With the relapsing episodes of polio, the government is really trying to make sure none of us we are getting infected, or even our children. So that's why I get the injectable polio at 14 weeks. Then we'll go getting vitamins, the multivitamin, at around 6 months. Then we get the measles vaccine. Remember, nowadays it has been improved. We also protect against rubella at that time, of which we give at 9 months. Then for our girls, we need to give at least the cervical cancer vaccine at the age of 10. That is repeated after 6 months, while measles, we'll have to redo it at around 18 months. For that, we'll believe our babies are all vaccinated, they're safe. And then there may be additional other vaccines that might benefit, but they're not in our schedule of the government.
And when we talk about vaccines, it's not only important for children, but also for adults, especially those with underlying chronic conditions, especially in this season. Dr. explain this.
If you ask yourself why it is that you're doing a vaccine, then it means that logic applies to anyone. That you're doing a vaccine to prevent the illness itself, right? Yeah. So for anyone with a weakened immune system, whether it's because of age, let's say for younger children, or people above the age of 65, or people with chronic conditions, let's say people with heart conditions, people with diabetes, people with renal failure, people with like an immunocompromised state, in the sense that your immune system is not working normally. So people undergoing chemotherapy, people with HIV, and then people whose lifestyles put them at risk. It means there's lots of people who ideally should be getting vaccines, but they're adults. Because in our minds, we've associated vaccines with being a child. Yes. It means no one is thinking about giving these vaccines to people. So it's an important conversation that we should be having, especially now in the setting of COVID. When you look at the population that is bearing the brunt of COVID, it's the elderly and it's the people with other health conditions, which essentially is an indicator that their immune systems are compromised. So the same is true for pretty much every other vaccine preventable illness, that those same people will be more at risk of those illnesses than the average person. Now, the other thing is something like influenza. Influenza is a seasonal disease, but here it's prevalent throughout the year. Now, because we can't predict with any certainty who's going to get influenza, it's a vaccine that pretty much everyone should be getting. In the setting of COVID, it becomes even more important because the symptoms of influenza and the symptoms of COVID are pretty much the same. Yeah, so there's a lot of vaccines that adults should be considering, depending on what your particular condition is, that a lot of people have never even had exist.
And speaking about not hearing, do physicians actually suggest these vaccines? Because to be very honest, when I hear 26 life-saving vaccines and I know I was taken care of until the age of 10, I'm thinking I'm good until I leave this world.
I think one of the challenges with being a physician is how many hats you wear. You know, someone walks in and it's an emergency and, you know, let's say their blood pressure is through the roof. The last thing on your mind is telling them, oh, you know, by the way, you need to have an influenza vaccine, you need to have a meningitis vaccine, you need to have a pneumonia vaccine. You're thinking more of, okay, what do we need to do? And then because the chain of contact with healthcare is constantly being disrupted, the nurse takes your vitals and then maybe if you're admitted to hospital, they'll be taking care of you. The doctor comes and, you know, how are we today? Are we better than yesterday? So the point at which you can have this conversation sometimes is limited. But then the flip side of it is this, that a lot of people are apprehensive about vaccines. If you mention, I'm going to give you an injection, for a lot of people, a lot of adults, it's even worse in adults than it is in children. They freak out. So probably doctors just look at, we've tried to have the conversation, someone is like, Sindano. So it's okay. We will probably have this conversation another day. So there's lots of factors that lead to that. But the other thing is also that this information is not consistently being emphasized to physicians. I think it's part of the recurrent training should be that physicians are aware, because vaccine innovation is a continuous process. What vaccines were, even in KEPI, the Kenya Expanded Program for Immunization, what vaccines are there today were not there. Well, all of them were not there, let's say 5 years ago, 10 years ago. So there's a constant change. So someone who, let's say, like you're saying, someone who grew up in the 80s, the vaccines that were available to you in the 80s, and then someone who grew up in the 90s, someone who grew up from 2000 onwards, there's a constant change. So for everyone, including doctors, it's a continuously evolving thing, so the information has to consistently be updated.
Okay. Yes. And in September of 2019, if you remember, Kenya became the third country in Africa to actually roll out the first malaria vaccine after Malawi and Ghana. Now, speaking during the launch in Homa Bay County, the then health CS said this milestone would help reduce malaria infection among children under the age of 2.
The new life-saving jab is another blow against malaria as Kenya fights to reduce the number of deaths caused by the disease among children. Health CS Sili Kariuki launched the rollout of malaria vaccine in the country as Kenya joined Ghana and Malawi in efforts aimed at reaching 360,000 children per year across the 3 countries.
Malaria continues to be one of the top 10 causes of death in our country. It continues to be a leading killer of children below the ages of 5.
Global data show that malaria kills 1 child every 30 seconds and about 3,000 children every day globally. The fight against malaria has had positive milestones, the latest being the vaccine for children under the age of 2. It's a 4-dose vaccine that will be included in the routine vaccination for children. For effectiveness, the children will receive the vaccine at 6 months, 7 months, 9 months, and the last jab at 2 years.
Those with the children that age and are to become the champions of this vaccine, so that you speak to your colleagues to be able to bring the children to the health facilities.
The vaccine, which will be offered for free in public facilities, will be rolled out in 8 counties, namely Homa Bay, Kisumu, Vihiga, Migori, Siaya, Busia, Bungoma and Kakamega. Globally, over 61% of people killed by malaria each year are children below the age of 5, hence the push to have additional preventive methods for children alongside the already existing measures like use of insecticide-treated nets.
Tests done on the vaccine has shown that it can prevent the infection of severe malaria by up to 30% in the 6 to 24 months age group. Hence, this gives hope in saving the lives of children in Kenya, especially those living in the lake region where the condition is endemic. Eunice Omolo, NTV.
Now, Sami, being on the distribution side of things and, of course, manufacturing of the same, malaria is one of those diseases that has really been a thorn in the flesh in this country during this pandemic. Have you seen the uptake of the same going lower than usual?
I think I would speak generally for vaccines. And again, to Judith's point, of course, initially when COVID-19 broke out, in the case of Kenya in March, there was a lot of apprehension. There was a lot of scare. People were generally very, very scared. And during that time, there was definitely a slump and a change in the health-seeking behaviors. Normally, that people who would normally go for routine immunization, for instance, opted to stay away. Things have since improved a lot more now, and today I think, and with even the kind of advocacy and awareness you're doing today, this is, reassuring people that, again, the diseases have not taken leave because COVID is here, and that they will wait for COVID to run its course, then come back. What happens is that today, more and more people are coming back to get immunized. And from a supply point of view, from a manufacturer's point of view, again, just going back to my earlier point, we are working full-time, full-scale to ensure that these vaccines are accessible in general, not one or the other, but all of them in general. And as I said, even as we also look forward to a day that we will have a COVID-19 vaccine as well. So yes, there was a slump at the beginning, but things are looking up. More and more people are coming back now to get immunized. But yes, we need more and more of them to keep doing this.
Sami, have you been able to map out which parts of this country probably you have seen a slump that is more than other parts of the region, probably what you can call hotspots?
Well, I wouldn't have that precise data today. As I said, there was just a general slump, but general slump that went back. As I said, there's been plenty of advocacy even from government agencies to ensure, and also to reassure patients that the facilities are safe for them to go and get immunized. I think that has been at the base of what we are, everyone, and government especially, is trying to ensure that people can consider it safe to go back and get immunized. So no particular area per se, but just a general feeling. As COVID has scared everyone, not just in Kenya, but globally.
Okay, now let's talk about safety. Dr. mentioned a little bit about the concerns, especially for parents that worry that vaccinating their children will make them more susceptible to contracting COVID-19, as immunization is known to drastically suppress your immune system when administered before it takes. Judy, from where you sit, is this fact or fiction?
It's a fiction. Yeah. Because when you look at the vaccines, actually, they help to boost your immunity at this time. When we find that most of the time, our children who are getting infections, who are getting the COVID cases, most of them, you realize their vaccination schedule might have been compromised, maybe on the way. So we really advocate that despite this time, in fact, this is the time that we should be running, all of us running to a health facility to be vaccinated so that we can boost our immunities.
Ah, interesting. And still on safety, the same concerns have been verbalized by those with underlying chronic conditions and even travelers who have to get some certain vaccines before they travel, especially in the face of a pandemic. Where is the truth, Daktari?
I was actually hoping you were going to ask me that question because we now, there's a lot of misinformation around vaccines. And sometimes even doctors themselves participate in this, because one of the greatest controversies around vaccines that has since been proved to be untrue is vaccines and autism. And the person who set this off was actually a doctor. So the first thing to remember is this, that a vaccine is not meant to suppress your immune system. In fact, you do not want to give a vaccine when someone is unwell, because it ramps up the immune system. And your immune system, when you're unwell, is half the problem. That a lot of the symptoms that you're having is because of your immune system fighting the disease. So if you add a vaccine to that mix and it increases your immune response, it means you're going to actually have a much harder time. If you're running a fever today, I can't give you a vaccine. So the idea that giving a vaccine suppresses your immune system is the exact opposite of what happens. If you've seen the ideas behind what it is that we can throw at COVID, some of them were existing vaccines. BCG, now it actually looks like even measles, mumps, rubella gives some measure of protection against COVID. How do they do this? It's actually because they ramp up your immune system. BCG seems to give you an increased immune response to all manner of infections, right? So we can debunk that. We can put that away immediately. Now, the other thing is that if you have underlying conditions, giving you a vaccine, giving you a vaccine could be problematic. Now, of course, you don't just walk into a supermarket and buy vaccines and inject yourself. Vaccines are given under the direction of your physician, your doctor, your nurse, your in some countries even your pharmacist, right? Now, there's certain vaccines that, depending on what your condition is, we might delay or we might even avoid altogether, because vaccines come in many types. There's live vaccines, there's live attenuated vaccines, there's killed vaccines, there's conjugate vaccines, there's polysaccharide vaccines. All of those vaccines will be administered depending on what the condition of the person getting the vaccines is. So in a proper hospital setup, it's unlikely that you're going to be given a vaccine that doesn't suit your particular concerns. So to answer that question, when it comes to vaccine safety, vaccines are probably one of the most tested drugs that we have available to us, and they are constantly being improved. Sometimes you even remove things from vaccines, not because there's any proof that it's problematic, but since the public is worried about having that in a vaccine, it's removed from a vaccine. So in terms of safety, I would say, like, I was having a conversation with Sami just before this started, and I was telling him, the interesting thing is this, that vaccines are the one thing that if you don't have a fever, can be given without a second thought. Almost every other medication, you need to consider what's the weight, what's the height, how old are you. But vaccines, for example, the Rabies Vaccine, it is the safest medication known to man. Why? Because it's been administered in pretty much every setting you can imagine. Because a dog will not ask you, are you pregnant? It will not ask you, how old are you? It will not ask you, are you running a fever? It will bite you. So the Rabies Vaccine is, strangely, the safest medication known to man. Why? Because it's given to save lives.
Yes. And perhaps now that you mentioned earlier about some of those really important vaccines for adults, there's a question to you. Please name these vaccines out there that should be considered.
At the very top of that list is an influenza vaccine. The influenza vaccine should be given to pretty much everyone every year. Now, when you begin to break it down into age groups, for example, people above the age of 65, you want to do a pneumonia vaccine for them. But the pneumonia vaccine can also be administered to younger people, because we need to remember that while every Kenyan child born after 2010 has gotten a pneumonia vaccine, anyone born before 2010 in this country, unless you can remember getting that vaccine, you did not get a pneumonia vaccine. When you look at for example, like measles, mumps, rubella. For a long time, we kept having outbreaks of measles in this country, because if you do measles at 9 months, you only have a 50% take, in the sense that for every 10 children you vaccinate at 9 months for measles, only half of them are immune to measles. Until we started doing a second measles vaccine, we continued having outbreaks of measles. And the thing is this, because measles can affect anyone, adult, child, it means a lot of Kenyans today are at risk of getting measles, unless they've had measles. Now, something like the cholera vaccine or the typhoid vaccine, these are things that we talk about on. In Kenya, if you go to hospital, they say you have three things. You have bilharzia, no, you have cholera, you have malaria, or you have typhoid, right? Now, the challenge is this. They have very similar symptoms. Now we have a vaccine for typhoid, we have a vaccine for cholera, and we are about to, hopefully in the next couple of years, roll out a national vaccination for malaria. So there's...
No, malaria we already did.
No, it's, when you think about it, it's regional. If you want to get a malaria vaccine in Nairobi, you can't.
You have to go all the way to Western.
So let's say, for example, if you're from Busia or you're from Siaya and you're traveling up country with your child doesn't have a malaria vaccine. So and these developments are exciting because these are the things that we've struggled with for the since independence. But now we have vaccines available for these things. So what we need to do is to embrace that vaccination and to, every time you see your doctor, ask them, what vaccines can be done for me? Because an average hospital admission in this country, whether it's in a private hospital, in a public hospitals, will set you back anywhere around and beyond 100,000 shillings, right? All the vaccines for the first year of life, even if you are to pay for them yourself, will not cost you 100,000 shillings. So for all vaccine preventable illnesses, the conversation between doctor and patient should be, at this sitting today, what can I get? Yes. Okay. Now, Sami, coming from a Pasteur's point of view, what are you doing to counter the myths and misconceptions that Daktari is talking about, and especially those that are so fearful of the side effects that vaccines come with?
I think Dr. Gachanja has given a very good example with the rabies vaccine. But again, vaccine manufacturers recognize the fact that for the most time, in almost all the cases, vaccines are given to healthy people. And when you are healthy, people will abhor discomfort. And that's why a lot of care has been taken to ensure that vaccines are safe. The fact that they are tried in different populations across the world, in different sites, and even in countries in different sites to ensure that if any side effects whatsoever is detected early in the process of development, and even post-licensure, after the vaccines become available for generalized use around the world, manufacturers follow through to make sure that they not only follow on any untoward reaction to any of the vaccines. So again, vaccines are not just one of the greatest biomedical inventions in the past 100 years, but they are also safe to the extent that today, and it is a widely recognized scientific fact, that in terms of combating infectious diseases, vaccination comes second only to the provision of clean drinking water. That just tells you how close it is to an ideal situation whenever, if you can. In fact, really, our enduring wish should be that we eventually develop a vaccine against every single infectious diseases. Dr. Gachanja has mentioned progress is being made to even have vaccines against some of the cancers, including human cervical cancer today. But vaccines are safe. Vaccines work so well that some of the disbelief from vaccines is because they've almost cleared many of the diseases that you used to fear, like polio. And to that extent, because these diseases are less and less visible today, people start developing, ideas about maybe the vaccines may not be that effective, just because they work so well. So vaccines work well and they are safe.
Okay, we'll talk more a little bit about that in a moment. Now, as Sami is mentioning, the Independent Africa Regional Certification Commission, ARCC, for polio eradication officially declared the region as wild polio-free. Now, this marks the eradication of a second virus from the face of the continent since smallpox 40 years ago. Polio affects children under the age of 5, sometimes leading to irreversible paralysis. Eunice Omolo with more.
The ARCC's decision comes after an exhaustive, decades-long process of documentation and analysis of polio surveillance, immunization, and laboratory capacity of the region's 47 member states.
August 25th, 2020 marks a huge day in the history of the fight against polio. After 4 years without a case of wild polio, the WHO African region has finally been declared free of wild polio virus. We must continue to protect Africa's children against all forms of polio and other childhood diseases, ensuring they are protected by immunization.
In 1996, African heads of state committed to eradicate polio during the 32nd ordinary sessions of the Organization of African Unity in Yaoundé, Cameroon. At the time, polio was paralyzing an estimated 75,000 children annually on the African continent.
We had to reach every child. We had to know exactly where that child has not been reached with the vaccine. It was not an easy journey. We had to rely on getting data, reliable information, analyzing that information, and then coming up with specific innovations, strategies and approaches for us to ensure that we reach the children despite those challenges.
The last case of wild polio virus in the region was detected in 2016 in Nigeria. Since 1996, polio eradication efforts have protected up to 1.8 million children from crippling lifelong paralysis and saved approximately 180,000 lives.
It was really a story of human perseverance, innovation, commitment, and really bringing communities together towards one unified goal.
Kenya has been running routine vaccination programs targeting children under 5 to prevent the spread of the circulating vaccine-deprived polio virus. Eunice Omolo, NTV, Nairobi.
So are you part of them?
So these are some of the wins when it comes to immunization and administering of vaccination, as we are speaking of this morning. Now, Judy, a lot of the vaccine preventable diseases have seen door-to-door campaigns, especially that of polio in the past, to increase the coverage of the same. Is it possible to replicate the same strategy for other vaccines, especially during a pandemic, to ensure that we can reach out to more people?
I believe we should do that. When you look at this current situation, we realize most of the numbers of immunizations dropped drastically because of fear going to the health facility for them to be vaccinated. And you can remember the way Dr. has mentioned, we have those people who have conditions, let's say those chronic conditions that really need to be boosted. And you know, COVID is here to stay for some time. And for us, I would prefer that if you can extend, like from door to door, it will be a good idea. However, there was a trial, but the challenges were so simple. They were scared if you are moving from door A to door B, how safe are we that you've not contracted from door A getting to door B? But I think the public is now informed, and we can embrace that.
And Dr. Gathuki, you were mentioning earlier you had to do a bit of vaccination at the weekend in the counties. And when it comes to our expectant mothers, the expectation is that they go to the next healthcare facility to get these vaccines that they need during the 9 months. But things have changed with the worry about COVID-19. Is it possible to probably make use of the community health volunteers to map out where these women are, and then the vaccines can be taken to them?
I think the idea with the vaccines is to demystify them, to make vaccine access as easy as possible. It's not just the fact that people are afraid of coming into hospital. The same people who are supposed to be administering these vaccines, we have a finite number of healthcare workers. Yes. So if a lot of the nurses are doing triage for, are you running a fever, do you have COVID? And then, of course, there's a huge surge in the numbers of people in hospital today with COVID. In fact, right now, if you wanted an admission to hospital, for cholera, let's say, you'd be unlikely to find a hospital bed. Why? Because they're full of people who are suffering from COVID. So if we can find a way, if we forget the challenge of COVID for a moment, if we can find a way to ensure that anyone who needs a vaccine is getting that vaccine, even if they're not coming in. Because a lot of mothers also do not find out they're pregnant until 6 or 7 months into the pregnancy. So this mother was supposed to have gotten 2 tetanus vaccines. By the time she's checking in, there's not enough time for you to do 2. So what do you do? So the idea is to increase the outreach of healthcare, so that anyone who, let's say, for example, now we have COVID hotlines. Why don't we have hotlines for, malaria? We have hotlines. So, because if you look at the numbers for malaria in this country, up to this point, malaria and COVID have killed about the same number of people for this year.
Oh.
Which then means that while COVID is the 300-pound gorilla in the room, there's lots of other things that are vaccine preventable and are a constant menace in our society. But we've never come up with a strategy that allows, let's say, for example, if I know I'm going to go to Kisumu tomorrow with a 1-year-old child, there's a vaccine for malaria available in Kisumu. Can I call a number and say, look, I'm coming. I want you to protect my child when I come home. So it's demystifying it, and it's allowing everyone to access healthcare information, because a lot of the time is actually the information. Once you have the information, if I call in and I'm told, okay, do this, as soon as you go to Kisumu, go to the Provincial General Hospital and have your vaccine done, people will do it.
So are we saying we can make use of our community health volunteers who know how?
We absolutely can. We absolutely can. Every soldier in this fight is important. So every person that we can recruit to either carry that information to the people that they go to, because these community-based practitioners, if the only thing they do is to identify and tell them, look, you should have this vaccine done for yourself, and get their phone number. Pretty much every Kenyan adult has a phone number now. Get their phone number, feed it into a central database. Then there will be follow-up. Becomes so much easier.
Okay, and we'll talk more about this even as we understand better where the gaps are in Kenya and how we can improve on the same, going by the lessons we have gotten out of this pandemic. And speaking of which, we had asked you on the question of the day to you is, are you willing to get the COVID-19 vaccine? If not, why? What are your concerns? Well, you are speaking to us on that hashtag New Normal, if we can have that up. Zedek Obunga says, I'll not mind taking a job. If my death comes as a result of that, so be it. Zedek, clearly you made up your mind. Mark George Nyausi says, I ain't willing to receive any COVID vaccine as far as I'm in the right sense. My immune is okay. Well, we pray that you stay that way. Nuri Gakweli says, no, it will weaken our body's immunity. We are not experimental rats for easy and fatal businessmen. Well, here comes the myths and misconceptions around vaccines, as Daktari was talking about. Kenywa Danny says, yes, I'm willing to be vaccinated if only it's the only way out of this pandemic. Kenywa, we hear you. Ken Saul says, I won't accept any vaccine. I better develop herd immunity. We'll talk more about that even as Daktari walks us through this vis-a-vis getting vaccinated. Calvin says, no, I'm not certain if it could have any negative long-term effects. We hear you on the concerns. Joseph says, I'm not ready for the vaccine. This is because I suspect that there is a hidden business in this COVID-19 story. Well, Joseph, which one exactly? The fact that COVID is with us or the vaccine itself? Please elaborate your concerns a bit more. But remember that hashtag is a new normal, even as we understand if you'll be willing to take the COVID-19 vaccine when it is ready. And if not, let us know why. At this point, we take a short break. We'll be back.
digital financial services. How has the uptake of digital-enabled solutions impacted formal financial inclusion in Kenya? How can these solutions be harnessed to address disparity in accessing formal financial services going forward? What can we do to onboard the remaining 11% of the population who are still locked out in complete exclusion? In the next edition of Business Redefined, we speak to KCB Group's Head of Digital Financial Services to unpack this and more.
Across Africa, countries are adjusting to a once-in-a-century health crisis. To unlock new opportunities, rediscover untapped value addition, accelerate development. Can we, as Africa, strengthen the resilience of business and increase the agility of the labor market? Can we harness the realities of the new norm to power partnerships across sectors, boost production, and deepen shared prosperity even to the most excluded? Nation Media Group brings you the second edition of the Kusi Ideas Festival. The theme, Towards a Post-COVID Africa, Recovering Together. The Kusi Ideas Festival, which is brought to you by the Nation Media Group and Kisumu County, will be on the 8th and 9th of December at Ciala Resort in Kisumu.
Huyo jamaa unaangalia hapo unamdespise atiana form. Hey, shida. Mungu halali, kuna day utapatana na yeye ameomoka mbaya. Gari ni ile nono na life inamwendea fiti. Na wewe umechapa. Mako. Do hivi, jisort na umorio. Mjenge life. Usije ukaregret maze.
To get Gisort na Morio by Vuma, dial *811 *930#. Skiza na Nation.
Beginning. Thank you for staying with Your World. My name is Gladys Gachanja. Today the conversation is vaccination in the pandemic era. We have had a lot about vaccines, bust some myths and misconceptions around them, even as we engage Dr. James Gadhuki, who is in studio with me. He's a family physician, Judy Nabakwe, who is an immunizing nurse at Gertrude's Children's Hospital, and Samin Dongo, who is the Sanofi Pasteur East Africa head. Thank you for staying with me on this conversation. And I hear there are a lot of concerns and, of course, feedback coming from that question. Are you willing to take up the COVID-19 vaccine? If not, why? Chebet says, what if it's another method of depopulation? There goes that concern. We'll get to it in a moment. Alfie Tiffy says no, because Kenyan vaccine in one sentence is grammatically incorrect. We hear you. David says, no, because I don't trust my countrymen. Interesting. Susan Wanjogo says, mimi kwa sasa naogopa kudungwa sindano yoyote. Niko na phobia. It's a pass for now. Next patient, please, for the same treatment. This is what Dr. Gadhuki was talking about. Isaac Kimgeno Labosa says, no, fear of the unknown, reaction with antibodies. Daniel CTNA says, no, my immunity is enough. Can't trust anybody nowadays. Daniel, we hear you on that concern. Sophie Tirike says, I will be the last to receive the vaccine after you've seen how it works on everybody else, Sophie. Well, keep your feedback coming through on that hashtag new normal, even as we better understand what vaccines are for, and also try to answer some of those questions that are coming through. And speaking of which, with the concerns that we are seeing, Sami, some religious factions have in the past called for the boycott of some vaccines, or anti-vaccination kabisa, claiming it's meant for population control. You've had one of the feedback there was actually saying this is another way of depopulating the country. How do you go about negating such fears?
You know, thank you, Gladys. Generally, as a people, we generally tend to believe anecdotal stories as opposed to evidence, scientific evidence and fact. And so many times we see only that which confirms what our belief is, as opposed to what the science or the reality really is. We just see what we want to believe. But having said that, you know, there's something called, and I see it a lot in the comments that have come from the hashtag, where there's something called omission bias. Omission bias is where the fear of causing harm by doing something is greater than the fear of causing harm by not doing anything. All I can say is that if the people here had an opportunity to look into the lives of the scientists that are working 24/7 to bring life-saving vaccines to the people, many people have dedicated their lives to ensure that the very last person on earth does get a vaccine. And I said, of course, the COVID one that will come, but the one before. It is normal for us to associate outcomes with certain things. And as I said, because the benefits of vaccines are today less and less visible because the diseases have been put under control because of vaccines, people then tend to theorize and come up with all sorts of hypotheses as to this is because of this or this is going to happen. For avoidance of doubt, there is not one disease that has been controlled through this famous word, herd immunity. Gladys, I also grew up in the village, and there was malaria, and before my time and my grandmother's time, there was malaria. Why haven't we ever developed herd immunity against malaria?
Good question.
Rabies has been killing people since before Louis Pasteur's death in 1895. Rabies continues to kill people. Why haven't we developed herd immunity? I think it's good to realize that many people are protected even when they don't get immunized because their neighbors were careful enough to get immunized and therefore they disrupted the spread of disease. They then attribute their well-being to the robustness of their immune system, just because their neighbors were a lot more of their brother's keepers than themselves.
Okay, we hear you, Sammy, we hear you. And speaking of which, somebody throws a question to do with polio. Tumesikia polio vaccines mara nyingi sana. Please, Judy, clarify on booster vaccines and when one vaccine keeps being given over and over again, why do we go about it this way?
When you look at polio, let me start from polio. When you look at polio, I know the campaigns we were knocking doors like every month just to boost on that. Polio is caused by many sub-strains. There are many types of, many sub-strains that cause polio, of which every time when you get any infection of polio, we have to check which is the most causative organism of that, which type of strain, because they are indifferent. So for that particular, that's what we are going to get the vaccine against as a booster, just from door to door that we normally do the campaigns. For these other vaccines, we really advocate for boosters at the end of the day, because remember when most of the time the babies, they rely on the immunity of their mothers till the month of around 6 weeks. That's the time we introduce, as some fed, let's say like measles will fed by 9 months. That's why we really need to give a vaccine. Why we do boosters is just to make the body more fully immunized, very sensitive to the infection, so that at any time you get the infection, you can easily attack it and you get well sooner to avoid more complications, because most of the time our fear is the complications against that infection. and they're always controllable.
So when we talk about the composition of these vaccines, is it why sometimes when we hear those campaigns, there are parents who come out to say, my child had this side effect, but you'll see another parent who says, mine was fine?
Yeah, it is very important for us as health workers. That is a very important information that we really need to gather, which goes beyond the government as well. We go to the WHO, because that strain, remember, if at all we are having a reaction against it, we really have to stop it because of the side effects that are severe. At the end of the day, it will not be benefiting the client. So most of the time we recommend, in case of any side effect that we experience, for not all about the campaign vaccine, but all the vaccines, remember that those common side effects that I believe the health practitioner, especially nurses, when you are interacting with the clients, we always educate them. We tell them, we are giving you this vaccine, this is what you expected to experience. It might not be nice for the baby, but after 1 or 2 days, we expect you to wear off. But in case you find it's persistent or there's something else coming out of that, now you have to seek medical attention. And of which now that's the data that we really look up to, so that we can help also to improve the vaccine.
Okay, now Dr. Gathuki, just looking at the feedback we got this morning, apart from those with syringe phobia, we also have many adults saying that my immune system is fine, I do not need anything else in my system. Please elaborate further the importance of looking beyond you being healthy today.
I think we can use the example of the Americans as a way to break down some of these misconceptions about COVID. So the United States has 5% of the world's population, but it has almost half of the cases of COVID to date. Like, if you look at the numbers of COVID cases, the number of COVID deaths, there's a disproportionate number in the American population. Now, if indeed COVID was introduced into the world to, to get rid of certain populations, I don't think the Americans, being the most powerful country in the world, would be the ones bearing the brunt of this. It would probably be Africans. So clearly, I don't think there's a global conspiracy around COVID. Yeah, so, Africans, our numbers, when you think about it, in the same time period that we've had COVID in this country, more Kenyans have died on Kenyan roads than have died of COVID. I'm not trying to, in any way, and I need to be clear about that. Every life we lose is a great loss. Every Kenyan matters. We need to keep as many people alive as we can. But the idea that COVID is some conspiracy, 5G and whatnot, a lot of that, when you scrutinize, it doesn't stand up to scrutiny, right? So that's one. But the second one is this. When you talk about herd immunity, again, the Americans now are at almost 200,000 cases a day of COVID. If anyone was going to develop herd immunity, it would be the Americans. But they're still dying of COVID. They're still getting more and more cases of COVID. So we can pretty much disabuse. And a lot of people talk about herd immunity, and they have no understanding what herd immunity means. Herd immunity means that you get enough of the population immune to a disease, whether by a vaccine or by getting the disease itself, to the point where, let's say there's 5 of us in this studio. If 4 of us have had a disease, the 5th person is protected because the people that the 4 of us come into contact with, even if they have the disease, will not pass it on to the 5th person. That's the long and short of herd immunity. The quickest way of achieving herd immunity is to do a vaccine. Because if the disease itself is one that we are worried enough about, that we want to develop herd immunity, do you want to stand the risk of you being the one who gets the disease so that you can protect other people? Well, the disease could kill you. So that's why when we talk about herd immunity, the concept of herd immunity is actually because of vaccination. It's not because of getting, what Sammy says is entirely true. In this country, almost everyone has gotten typhoid, right? Why don't we have herd immunity to typhoid? Why are we still cholera outbreaks in high-end hospitals, high-end hotels? I mean, if we were going to develop herd immunity, we would have developed it by now. So now, the third one is this. I've had a lot of people asking about, the vaccine that is going to be done is going to be introducing nanoparticles, it's going to be introducing microchips, it's going to be a way to follow. I mean, if anyone wants to follow you, they just need to use your mobile phone. So a lot of Kenyans, if you want to know where they are, you just need to follow their social media feed. No one is interested enough in following you to insert a nanochip when you're already giving them that information for free. The converse of this is this, that the reason why we are able to develop these COVID vaccines at the pace we are at now is because it is a global emergency. You could be a billionaire right now. All the money in the world is going to kill you. The same amount of money that is thrown towards cancer, because anyone can get cancer, is being thrown towards COVID. And that's why you're seeing such an acceleration in the speed in which it is that we can get vaccines now. It's a money thing. The reason why the malaria vaccine took 30 years to develop is because malaria kills poor Africans. So there's no emergency to sort it out. The reason why HIV has taken such a long time, trust me, if HIV was a disease amongst the wealthy countries, would have gotten a vaccine for it by now. Because all of these things, imagine today you have a condition that you need to develop a vaccine for, and you have 300 potential candidates as vaccines. How much money does it require for you to test all 300? Now, there's enough money in the world right now to test more than 100 different vaccines for COVID. Why? Because everyone is invested in it. Yes.
Okay, that's a good way of looking at it and understanding why there's been an acceleration of the same. And speaking of which, the world is hopeful about this COVID-19 vaccine, and most of them are in trial. Some, they say, as early as next year, we could be getting vaccinations of the same. Do we have concerns when it comes to administering the same in children, Judy?
We have the same concern. We are really interested to know exactly what are the main side effects, how we are going to give the vaccine, and even the storage, because we've had a lot of information about the storage. Most of the vaccines, they differ. There are those very low degrees. And remember, we are trying to reach each and every child in the country, of which we have to go till those mashinani areas. So we are really interested, looking forward to that. And we pray we get the vaccine as soon as possible so that we protect our children.
And for the adults, we already know a huge number have enrolled with the government for trials, including this country. Are there specific categories that qualify for such trials, Dr. Gathuki?
Ordinarily, when you're doing trials, you want to cover as many subsections of the community as possible. So you'll try, when you're doing a vaccine trial, depending on what the target for the vaccine is, you'll want to do it in people with let's say with people of certain age groups. So you want to do it in under 12s, you want to do it in you know, from 12 to maybe 24, then you want to do it for older people. So all of those different categories, they allow you to see what is the response. The initial stage of production of a vaccine is, do you produce antibodies? Can you detect antibodies to the vaccine once it's been introduced? And of course, you'll have a certain target. You have an idea of, let's say, if we can produce the same amount of antibodies as someone with COVID, for example, then it looks like we are succeeding. Then you go to phase 2, and then you go to phase 3. All of these different phases, the first one is the production of antibodies. The second one is, does it protect you against disease? That these people who are in the community, they are doing ABCD, living their lives, did they fall sick? And then now stage 3 is where you're trying to get it to a much larger population because of numbers. Now, all of those different stages means that when you're looking for volunteers for vaccination, you also want to see, can we have these volunteers in specific work areas? For example, people working in hospitals naturally are at greater risk of COVID or any other disease than others. So frontline workers, you know, what do you do for a living? Your occupation will determine whether you are a suitable candidate for a vaccine trial or not.
And this is exposure.
And this is exposure, yes.
Yes. Okay, interesting. Now, the pandemic, again, has brought with it fears. And if you heard from the feedback we heard earlier on, Sami, a lot of people worried about the side effects that are coming or might come with COVID-19. So how can the messaging by manufacturers be done around the same to quell these fears?
Thank you, Gladys, for that very difficult question. But I take comfort in the fact that many of the manufacturers, and Sanofi Pasteur being one of them, have been making vaccines for more than 100 years, for more than a century. In these 100 years, diseases such as smallpox have been eliminated. Today, we do not have young children getting paralysis from polio. The large number of outbreaks of measles that used to be, to the extent that, people of the age group of my grandmother would lose all their children to measles. It doesn't happen anymore. So we have a century of concrete evidence. And that's why I'm coming back to the fact that vaccine manufacturers, and indeed scientific as they are, we take comfort in what the data shows us, in what the science shows us. And science today shows us we have practically eliminated 99% of all cases of polio without a cure for it. There is no treatment for polio. There is no cure for polio. All these have been reversed because of immunization. And Dr. Gadhuki seems to like the American story. There is an American president, Roosevelt, who actually suffered from polio. And he put in a lot of money in the research of a polio vaccine because as president, he actually was paralytic because of polio. Today, more and more children, to the end of the world actually, benefit from a polio vaccine. And that's why they're able to live their full lives with their arms and legs intact. So science today, evidence running into 100 years, shows us that vaccines work. And there is nothing to illustrate, there is nothing to give us doubt that even going into the future, these vaccines will be anything else other than life-saving. Perhaps what we should all be doing is to do what we can in our part to extend the life-saving power of all vaccines that are today, that are available today, and those ones that will become available. To Dr. Gadhuki's point, these vaccines are developed because the diseases are a real threat to the well-being of humans, including their lives, and including economics. Today, lives have been disrupted. People have lost jobs because of COVID. A COVID vaccine will ensure that people can go back to their normal ways of living and to their normal works.
Okay, Sami, of course, you speak with so much confidence because you are in this space. To a layman, all that sounds very removed from them. And the first thing is, am I safe? So, is it possible in a day where technology, social media is so rife, can we have messaging that actually boosts confidence in the population?
Thank you, Gladys. And I think there's a lesson 101. We will do our best to communicate in a way that it gives confidence, in a way that inspires confidence. But again, to your point today, we have plenty of information. What I've just said about an American president suffering from polio in the 20s is something people can verify thanks to the internet. There are a lot of good sites that we can visit to confirm, and WHO is a good site to review. It's independent. Look at what WHO says about immunization against all these diseases for which a vaccine exists. But yes, part of what we are doing today, we will keep on coming to you to assure you that evidence and data and all we can see around us is that vaccines actually work. If today you're bitten by a rabid dog and you do not get immunized, the truth of the matter is, as sure as tomorrow will be Tuesday, that person will almost surely die from rabies. That is just an illustration, closer home, that vaccines work.
Okay, Sami, we hear you loud and clear. And again, those questions around vaccinations are coming through, and especially one about the upcoming COVID-19 vaccine. Remember, we are having this conversation on that hashtag New Normal. Are you willing to get the COVID-19 vaccine? If not, let us know why. Someone says no. Why prolong life na vile maisha Kenya ni noma? Sam, surely you must want to live a little bit longer. Jane Dongo says, yes, as soon as it lands here. Okay, Jane is very optimistic. Karori says, I was willing, but yesterday I saw a clip of one being injected. Wacha tu. Sasa, shida ni the sindano or the vaccine? Kigen Kipkeboy says, I'm ready if it's free. That is actually a good thing to think about. Patrick Karioki says, inaweza ni affect, ini suffocate. Patrick Mukungi Musia says no. Moderna and Pfizer vaccine uses RNA formula, which is dangerous with immunity. I can only take that very long name vaccine of Oxford once approved. Interesting one, and I'd like to hear what Dr. has to say about that before we take a short break. Ron Capes Kiprotich says, scam, money-making project. Again, as Dr. said, there are no scams here. The fact that money is being thrown at getting a vaccination as soon as we can is because the whole world is suffering from COVID-19. That's why we have this kind of success when it comes to the vaccine. And Dr. Gadhuki, you've had that question again coming up about the RNA factor. Let me even read out another one here from Enigma, who says, kindly ask the doctor why some scientists are warning against the current type of RNA gene-modifying vaccines, which essentially is where the COVID vaccine falls. What is this RNA gene to start with, Dr. Ari?
There are very many ways of making a vaccine. Now, when you're trying to make a vaccine, what you want to do is to try and get as close as possible to 100% success rate. That if I give you this vaccine, I want to try and ensure that you will have an immune response to the vaccine, right? Now, messenger RNA vaccines, the potential for them has been there for a long time. The only problem with a lot of science and technology is, as the technology matures, it becomes easier and easier to do certain things that were essentially impossible 10 years ago. When you look at mobile telecommunication, for example, what it is that you can do on your phone right now, anyone carrying a smartphone today probably has more processing power than they had available to them when they were launching a rocket to the moon. I mean, we cannot on one hand embrace technology and on the other hand get surprised when technology brings us different approaches, novel approaches to problems that have been there since, the time of Jesus, right? So the messenger RNA vaccine works in a similar way to how a virus gets your immune system to either mount a response or how it avoids your immune system. So there's nothing new about messenger RNA vaccines. It's only that now we can be able to develop them better and faster, right? Now, the other thing is this. There's a lot of clips doing the rounds on social media. Guys in lab coats, I remember there was one for this lady who was saying, chloroquine is the cure for corona. I don't know why no one else is struggling. I've treated 300 people who've all gotten better. Now, here's the thing. I've seen, let's say this year, I've seen 100 people with COVID. All of them have gotten better. So, am I going to say now that my treatment modality, that what it is that I put them on for COVID, guarantees that you're not going to die? See, the thing about data is you can't manipulate data for your own purposes and then now you declare that's the truth. So I saw the clip, the one that messenger RNA clip. When people talk about messenger RNA, they speak with so much authority. That clip was full of misinformation. That it introduces nanoparticles and blah, blah, blah. Messenger RNA is something that even in your own body is happening all the time. Cells need to communicate, right? So how does a cell, for example, communicate? How does the cell in your body that says, I have gotten a signal that COVID has landed in your throat, how does it communicate to your immune system to tell it, now what you need to do is to produce antibodies. We need to produce neutralizing, killing antibodies for this COVID or it's going to kill us. How it is that your immune system communicates is how it is that we communicate with your immune system via vaccines. So we are simply using parts that exist in your immune system for us to mount an immune response without you falling sick.
Okay.
For example, there are things called conjugate vaccines. Conjugate vaccines essentially are taking a protein, a specific protein from a bacteria, and then you introducing that using other carriers into the system that allows your system to respond like you've gotten the infection without getting sick. So you produce a lot of antibodies because a protein has been introduced. It's essentially like an allergic reaction.
Okay.
You produce antibodies because this has been introduced, and then subsequently, when you come across that specific infection, you're able to just clear it from your system. So mRNA, whether you want to talk about mRNA, you want to talk about killed virus, you want to talk about viral proteins, you want to talk about attenuated viruses, you want to talk about polysaccharide vaccines, you want to talk about vaccines that are grown in eggs. All of those are simply ways to communicate to the immune system. Yes.
Okay, I think we've just got schooled there in as far as how vaccines work, and I hope that answers your concerns in as far as RNA gene, what was that again? RNA gene modifying vaccines is concerned. Well, we're about to take another short break. I hear you still talking to us in as far as if you would take up the COVID-19 vaccine when it is ready. If not, why? Remember that hashtag is the new normal. But for now, we take a short break. We'll be right back.
I heard about the Equity Wings to Fly program. I applied and I was able to get in. They paid for everything, literally everything that I needed. I'd like to start an initiative like the one Equity started here to sponsor students.
Equity. Bega kwa bega.
Chrissy Bila worries. Chrissy na Naivas is now on with the biggest and tastiest offers this festive season. Every day, 350 winners Kula shopping voucher worth 2,000 shillings. All you need to do is simply present your Naivas card when you shop for your chance to be one of the winners. Naivas saves you money.
Did you know? At Ruiru Mabati Factory, you can open an account and lipa pole pole at your convenience. Did you know? At Ruiru Mabati Factory, you can get customized sizes according to your roof plan to avoid wastage. Did you know? Ruiru Mabati Factory offers free delivery countrywide within 72 hours.
To order, call us now on 0111 050 700. Ruiru Mabati Factory, Mali Safi, kwa bei.
It's a full house this season when the family comes together.
To reconnect.
One thing we do, we watch GoTV. We love it.
He is everyone's favorite place this festive season.
Usimiss out. Get GoTV decoder kwa shilingi 1999.
GoTV. Love it.
To achieve great things in life, you must do little things every day, like the 1, 2, 3 with Colgate.
1, wake up, wake up. 2, brush up, brush up. 3, smile through your day with a fresh breath and strong tea. Smile through your day with a fresh breath and strong tea.
Do the 1, 2, 3 with Colgate and give yourself a future to smile about.
It is your world. My name is Gladys Gachanja. Let's take a look at the other world. Now, Naples is proud of its tradition of cafe sospeso, where a customer pays twice for a coffee so that someone else or someone who is less fortunate can have one for free. Now, this act of charity is being extended to coronavirus tests in the southern Italian city, where the health service is struggling to deal with the surge in new cases. In a church in one of the most densely packed areas of Naples, recalls a local community organization offers residents a chance to get a rapid swab test and anonymously donate another. Since they started 2 weeks ago, 1,000 people have been tested, 300 of them benefiting from the generosity of their fellow citizens. Being your brother's keeper. Now demonstrators marched through the Mexican capital and scuffled with police during an angry protest at widespread violence against women in a Latin American nation. Around 10 women are killed every day in Mexico, and activists accuse the government of not doing enough to tackle the problem. Holding banners, flags and placards, thousands of protesters demanded justice for the many victims of femicides on the International Day for the Elimination of Violence Against Women. Protesters marched to the city's main square, where some faced off with riot police trying to stop them defacing the walls of a presidential palace and the cathedral with paint. Around 3,800 women are killed each year in Mexico, while 6 in 10 women have suffered some form of aggression in the past decade, Interior Minister Olga Sanchez said. And something that focuses on our conversation of the day: take a vaccine developed in haste? Well, never again, says Maysa Chebi, who, like hundreds of other young Swedes, has suffered debilitating narcolepsy after a mass vaccination campaign against the 2009-2010 swine flu pandemic. The experience has shaken Swedes' confidence in any future vaccine against the new coronavirus, compounding fears about unknown long-term side effects.
I'm not planning to take the vaccine because it is too many questions about why. We're just reading it, what's going on with the vaccine and who is going to take it to be immune.
Of course, when you have a new vaccine that we don't know very much about yet, against a disease that we don't know very much about, of course everybody is still wondering, and they want to have more information before they take a decision on this. I think anything else would be very much surprising. Vaccination mot säsongsinfluensa som har gått igång, bara för att påminna.
Now, Britain and France have announced their intention to ease coronavirus restrictions in the run-up to Christmas as a second wave of infections subsides following weeks of lockdowns in Europe. Now, French President Emmanuel Macron announced that shops could reopen at the weekend and that nationwide stay-at-home orders would be lifted from December 15th. The British authorities also announced that restrictions on social mixing and travel would be eased across the UK over Christmas, with up to 3 families allowed to mix over the festive period. Germany's 16 states have also agreed to slightly loosen limits on social contact over Christmas. State leaders agreed to cap gatherings to 10 people over the December 23rd to January 1st holiday, double the limit for the rest of December. These compromise measures come in effect in areas that had asked for lighter restrictions.
8-9 hours today because the
So we're about to put to bed this conversation on vaccination in the pandemic era, but before we get to it, more of your feedback, even as we asked you if you'd be willing to get the COVID-19 vaccine when it is ready. If not, why? Manuel Simiu says because none of the politicians or their children will be willing to get the vaccine. I guess that's a no for Manuel. Coach Mafia says no. When COVID-19 millionaires chewed everything and later focused on BBI, we developed herd immunity. Otherwise, would have all died. So no for the vaccines. We are okay. Who is we? Speak for yourself, my dear. Speak for yourself. Pablo Mendez says, I really am. I have nothing to lose anyway. Things are going to get tough soon after BBI, so why not? Where do I apply? Can I be the first? Well, the clinical trials are ongoing. Mwangi says not for now, as they are still doing their vaccines trials research and they have not achieved 100% immunity. Remember, they are still in trial and will only be released to us when they are ready. Sairia says, no, I'm not. We'll wait and see what happens to the guys who get vaccinated first. Clearly, you and Sophie are in the same WhatsApp group. You shall wait and see. Abubakar Moro says, can't trust anyone yet. They might be conducting field tests with us as guinea pigs or white rats. We hear you, Mboro. Morgan says, absolute no. For me, let the legislators be first in line in a public setting. We hear you, Morgan, and clearly a lot of concerns around the safety of this vaccine that we are all waiting on. So there is the need to take it up, but also the worry that what could happen to me. And Dr. there's something that has come up and I'd like you to clarify on. When do you say a vaccine is ready for use? Right now, we know we are undergoing clinical trials of COVID-19 vaccine. When do you say it's good to be administered?
When you think about what it is that you're trying to achieve with a vaccine, is to give as much benefit with as little harm as possible, right? So there are certain things that a vaccine needs to achieve before we can say now this is ready. Number one is actually the safety. The safety of vaccines is primary, because there's no point of giving vaccines to 100 people and then even one person gets a side effect, right? So it's even understanding these side effects, who gets them and why do they get them. Now, the one thing to remember about a vaccine is this. We all have unique immune systems, right? All of us here in studio could get a mosquito bite. One person might not even notice, another one might get a swelling that is enough for all of us to see from across the room. One person might get a bee sting and actually die from the bee sting. Well, the rest of us will, it's painful, it's a bit of swelling, but you're fine. So the same thing is true with vaccines, that there's people who, for one reason or the other, will respond poorly to a vaccine. But then, what is the greater good? Okay? So that is the first one. So you try and minimize side effects as much as possible. So all along, from the first stage, second stage, third stage, you're looking at what side effects are you getting from these vaccines. That's one. Number two, efficacy. How many of the people given a vaccine mount an immune response? Now, the thing to remember is this. Different vaccines actually give you very different immune responses. One of the reasons why we keep repeating the polio vaccine is the polio vaccine, the oral polio vaccine is a poor inducer of an immune response. Of 10 children getting the oral polio vaccine, only about 5 to 6 of them actually mount an immune response to polio. And that's why there's that persistent drive, that consistency of because the thing is this, we would need to test pretty much every Kenyan child for antibodies against polio for us to say, okay, I think we can stop now. So the logistics of doing that and the cost of doing that vis-a-vis just keep doing the polio vaccine, and hopefully we keep increasing the number of children who've actually mounted an immune response. Now, so that's why you will see different vaccines have like different percentage immune responses. That's not to say, it's not a marking scheme that you're marking a vaccine against 100%. So if you get to 95% or 90 or 50 or 60, what it shows is that if we did this vaccine in 100 people, how many of them would we expect? And a lot of vaccines, the first round will give you a slightly lower number than the second time you do it. So every subsequent vaccine will tend to raise that number in terms of how many of these people are showing an immune response, right? So all of that comes into consideration. The third is cost. Because, for example, in this country, the reason why we can do oral polio so frequently is because it's cheap. A dose costs about a shilling. So there's 2 million children born in this country every year. So if you extrapolate that, it means like under 5s in Kenya are 10 million, give or take. If you're going to do a vaccine worth a shilling for them, it means it is going to cost you 10 million shillings, at least for the vaccines, to do 10 million vaccine doses in this country. If one vaccine costs 1,000 shillings to vaccinate 10 million children, the numbers, they change. That cohort, the fact that we have 2 million children born in this country every year is actually what limits the government in the number of vaccines it can give. Because if it's costing 10,000 per child for 2 million children, or it is costing 50,000 per child for 10 million children, all of those numbers change, right? Now, so the cost of the vaccine is important. There's vaccines that will be discarded because they are too expensive. Now, the number 4 is how are the logistics for this vaccine? A vaccine that needs to be mixed is going to be more difficult to administer than a vaccine that comes pre-mixed. A vaccine that needs to be stored at minus 40 degrees is going to be much more difficult to transport in African settings and to disperse than a vaccine that will survive at 2 to 8 degrees, which is where most of the vaccines are stored at 2 to 8 degrees, essentially in your fridge. So all of those things, and then also, how easy is that vaccine to produce? Now, that's the beauty of mRNA vaccines. And mRNA vaccines are much easier to produce because essentially what you're doing is you're producing a chain of amino acids that will communicate a specific message to your immune system and then it responds. So that is easier to replicate. Now, most vaccines, the turnaround time, and Sami can attest to this, the turnaround time from start to finish for most vaccines is a year. For most of them, you'll even go to 2 years. A lot of the times, you've done 1.5 years of vaccine production, then you realize, wait, it's not eliciting the immune response that we wanted. You go back to square zero. In fact, to be honest, vaccine manufacturing is a very risky business. The odds of, like Kenyans say, kuchoma na vaccines is very high. If one person did not observe the safety protocols for getting into a factory, the whole batch destroyed.
Aha.
So when you look at all of those factors, it means that actually the more funding that we can lock in for vaccines, the better for all of us.
Sami, coming from the ecosystem of manufacturing and distribution of the same, what are the chances that Africa will be enjoying the COVID-19 vaccine when it's released with the rest of the world?
I come back to saying this again, and I know I'm almost repeating myself. For over 100 years, we've provided everyone who requires a vaccine to the ends of the world that vaccine to prevent them from getting life-threatening diseases, and in some cases, to avoid sure death, in some cases where the disease is 100% fatal, like rabies. I have no doubt in my mind that when the vaccine becomes available, we will also be able to get the COVID-19 vaccine. In fact, we are all hopeful that these vaccines will become available as soon as possible, and I have no doubt we will get the vaccine. Nothing makes us happier than as a company, and as I said, the scientists working around the clock, but ensuring that no one suffers or dies from a vaccine-preventable disease. And this will not change with the COVID vaccine.
Okay. Sami, are you considering some of the factors that have been raised by Dr. Gadhuki about the administering of the same, storage of the same, especially for sub-Saharan Africa?
Sub-Saharan Africa has been capable of dealing with very complex issues. I think we can talk about the HIV pandemic and how adherence to treatment has been achieved. I would rather err on the optimistic end, that in the fullness of time, these systems will fall in place. There is no doubt that there is concerted effort to ensure that whatever temperatures will be required, those systems will be in place when the vaccine. I think we need to have the vaccine, and as soon as this vaccine is available, I can assure you, there is an unprecedented global collaboration. I think, for once, global collaboration between the inventors of the vaccines, the governments, and other supranational agencies to ensure that everyone, remember, this is a global pandemic. For the world to be safe, we need everyone to get immunized. That way, the world will go back to normal. The world will go back to economic growth. So I have no doubt that the vaccine will be available.
All right, so the COVID-19 pandemic has brought with it major lessons, and with health being a devolved function, how can counties ensure that immunization continues for our children uninterrupted to avoid dealing with future pandemics of vaccine-preventable diseases, Judy?
Excuse me. I believe at the end of the day, if we as the health providers, we could push more because we understand there are many challenges that make our clients not to come. If you can push more for our working schedule, sometimes you have to stretch a bit. Let's say the vaccine, the days that we've allocated for vaccines, if you can extend, we'll be in a position to capture even those who are defaulters. And also, if we also have more information, we educate our clients more on the importance of vaccination, the uptake will be more higher and we'll be in a position to prevent all these communicable diseases. And also, through that patient education, we'll be in a position to capture all those clients who will benefit from vaccinations the way we had stated a bit earlier. Like for those with chronic illnesses, those who are more exposed, let's say the diabetic, those who are hypertensive, those who have immunity compromised illnesses, they'll still benefit from these vaccinations. We as healthcare providers, if we are the frontliners, we advocate for the vaccinations and we do it on time. We reach out for those who are not who are defaulters. I think we'll be improving our health system and the coverage will be great.
Okay, thank you, Judy. And with travel inevitable and a huge population dealing with chronic underlying conditions and, of course, our expectant mothers all at risk, how can we ensure uptake and consistency of vaccines for these vulnerable populations, Dr. Gathuki?
I think the same is true for every relationship, whether it's patient-doctor, whether it's a relationship between friends, wife and husband. It's communication. That it's important that every time someone comes into a health facility, we are getting as much data about them as possible so that it's easier to reach out. I've seen a lot of facilities in even resource poor settings having a system that reminds their clients via text message that you're supposed to come in for this vaccine. And of course, if that person doesn't come in on that day, at the end of the day, you can actually look at how many people do you expect to see today, and then you can call them. So that I think what we need to try and incorporate into our healthcare systems is that communication where you're constantly reaching out. Instead of waiting for people to come in, reach out to them. Reach out to them and inform them that, on this date you're due for this, or we've done your antenatal tests and these are the results, so you need to come in so that we can start you on your iron supplements or whatever it is. So that is one. But then number two is, I see at the county level a mismatch in terms of when you're here in Nairobi and then when you're out in the counties, wearing of masks. You see, what happens is, I'll give the example of the seatbelt in cars. When the seatbelt was first introduced, people's greatest fear was you'd get trapped in the car. So if you actually look at your seatbelt, it has a little thing that you can use to cut the seatbelt. That was introduced to assuage people's fears about getting trapped in cars by wearing a seatbelt. We need to be consistent with our messaging that the three things that are vital in the fight against COVID is wear a mask. Wear a mask, wear a mask, wear a mask, wear a mask. In countries where wearing of mask has been embraced, the rates of COVID gone down. When you make it a political issue, you go the American way. Number two is wash your hands or sanitize. Now, washing hands is preferable to sanitizing. So provide washing points. Every time someone walks into a hospital, they should be washing their hands. Every time you leave that hospital, wash your hands, because while you might be asymptomatic and you might not get disease yourself, do you want to take it home? Wash your hands, wash your hands, wash your hands, wash your hands. Number three is social distancing. Now, the thing about social distancing that sometimes we fail to understand is it also means minimize your social interactions. We are going into a festive period now. A lot of us will be in matatus that are packed to the gills. If one person in that matatu that is carrying 100 people on its way to Busia has COVID, odds of everyone else, how long is the journey going to be? You need 15 minutes exposure to someone who's not wearing a mask. So how long is that? So the question you ask yourself is, you see, when we say, but we are not dying, we don't know that. The numbers are changing. If we got a breakdown for how many deaths we've gotten, I think in the month of November only, we've probably gotten maybe a quarter of all COVID deaths for the whole year. So those numbers are changing now. So what can we do now? What we can do now is to be consistent in our messaging. Avoid social contact. Wear a mask, wash your hands if you can. If you can't, sanitize. Until you have a vaccine, that's pretty much what it is that you can do. For people with chronic conditions, for people with vulnerable populations, please get at least a flu vaccine if you can't get a pneumonia vaccine. These are simple measures that we can put in place, and they are cheaper than losing one person to COVID.
Okay, and somebody actually says, ask Daktari, how about the children and adults who fall in the special needs category?
Well, special needs to be...
Neurological conditions,
yes.
And yeah.
Now, the thing to remember is this, that even children with special needs have an immune system, and the immune system is going to be protected by getting them to wear masks. If they can't wear masks, keep them at home. If they are due for vaccines, please have their vaccines done. There's no reason to postpone vaccines now because a child has special needs or as long as those vaccines are indicated for that child, please go ahead and have them done. Let us teach our children to wash their hands. Let us teach our children to, even if you're going to play outside where it is open. Because it is settings where you are indoors and masked are where it is that you have the most cases of COVID. Yes.
Okay, thank you for that. And Sami, clearly a lot of focus is in the ecosystem of manufacturing and distribution of vaccines. Now, as we said earlier, severally, Africa was declared free of the last remaining strain of wild polio virus achieved through vaccination. So what are some of the lessons we can learn from that going into the future?
I think without a doubt, what we can learn, what we have learned, what evidence shows us, even empirically out in the field, is that vaccines work. And all of us in our individual capacities, even looking to the future, what we should do is play our role in ensuring that we extend the protective power of immunization to every single living person. Today, people are living longer and longer than they did a century ago. On average, life expectancy has improved by between 15 and 25 years. And a lot of this has been attributed to just vaccines rolling back infectious diseases. So what we can do is, going into the future, let's embrace immunization, let's embrace vaccination. Vaccines do no harm. They do no harm. They work. If we had to just run into their statistics, if we had a vaccine against COVID that today was 50% effective, of the 1.5 million people who have succumbed to this disease, 750,000 of them would be alive today. And for those people, it would be 100%. Let's embrace, let's extend the information, the rightful information that vaccines work, vaccines protect lives, and vaccines cause no harm.
Thank you, Sami Ndongo, who is the Sanofi Pasteur East Africa head. We were also joined by Judy Nabakwe, who's an immunizing nurse at Gertrude's Children's Hospital, and of course, Dr. James Gadhuki, who is a family physician. Thank you all for giving us a lot of information and, of course, schooling us in as far as vaccination, and especially during the pandemic era. We all have learned a thing or two and also alleviated a lot of fears that come with the same. And I'm being told we are still getting that interaction with our question, are you willing to get the COVID-19 vaccine? If not, why? Madocho wa Kanairo anasema, until I see the virus itself, so far naona numbers kwa screen too. Hey, my friend, I pray that God keeps you safe as he has. Osinda says, hard immunity mambo yote. My friend, that has been described, and I think we all do not understand exactly what it means. Regan Smith Ngala says, yes, I would. And many people who are saying no here will when it's out because winter is coming. How is vaccine related to population control? Very absurd to portray such a level of cluelessness. If someone is hoping for herd immunity as their plan when they are saying they want a quarter of the world population to be wiped out, God forbid, inclusive of themselves. Well, Rigard, we hear you loud and clear, and a lot of those pointers have been reiterated during this broadcast. Thank you for joining us on the broadcast. My name is Gladys Gachanja. Before I bid you farewell, tomorrow we shall be focusing on the World AIDS Day celebrations. Remember, this is the day we take time to remember those who have passed on due to HIV and AIDS, but also those who have lived positively and are actually preaching the gospel of living positively and also living beyond the diagnosis. We'll be talking to experts and those living with the HIV tomorrow. See you then.
It's our responsibility to